Inverted papilloma, transitional cell papilloma or Ringertz tumor or Schneiderian papilloma. It is a tumor of the non-olfactory mucosa of nose, Schneiderian membrane, and paranasal sinuses. Most common site of origin is lateral wall of nose in the middle meatus. Less commonly it arises from the maxillary, frontal or sphenoid sinus. It is so named because hyperplastic papillomatous tissue grows into the stroma rather than in exophytic manner. Human papilloma virus is thought to be responsible for its etiology. Clinically, men are affected more than women in the age group of 40 to 70. It is almost always unilateral and presents with nasal obstruction, nasal discharge and epistaxis. It can invade sinuses or orbit. Orbital involvement causes proptosis, diplopia and lacrimation. On examination of nose or endoscopy, it presents as a pale polypoidal mass resembling a simple nasal polypus or polypi. Computed tomography (CT) and magnetic resonance imaging (MRI) show the location and extent of the lesion. MRI also helps to differentiate associated secretions in sinus from the actual tumor mass. Biopsy is essential for diagnosis. Care should be taken as simple nasal polypi may be associated with it or even the patient might have been operated for their removal. Treatment. Medial maxillectomy is the treatment of choice. It can be performed by lateral rhinotomy or sublabial degloving approach. These days endoscopic approach is preferred. In 10 to 15% of cases, it is associated with malignancy. Wider external surgical approaches may be required for tumor extending to the frontal sinus or orbit. Recurrence can occur. Radiotherapy is not advised as it may induce malignancy.